what do you mean by exercise? Is it something different from yoga?
Yoga is different, exercise is different. He's aware of his body, but he's not aware of his breathing. See, when I tell him just sit down, close your eyes and start breathing. And even I was afraid to go to an allopathic doctor because they used to give me injections and all. When you eat, no, you'll nourish your body. Okay. When you do yoga, you'll nourish your mind. When you say child not to watch TV, even the parent should be doing that. You're sitting and you're scrolling and you're telling the child not to watch TV or not to scroll. When your gut is healthy, your brain is also healthy, it will do its work properly. So what you eat is more important. Milk is not needed that much after 2 years. See, why we give milk is, I didn't have any idea about Montessori at that time. Then the day I came, I was surprised. I was like, I should study something. I don't know anything after coming there. Ravi sir was like, you go search, see in the book. They came and they explained wonderfully. I was mesmerized. What is this? How can children do all these things? I saw this freedom in this school and that made me to stay here till now.
Namaste and welcome to another episode of Dew Drops Podcast. We started this podcast series to bring you all the thought-provoking conversations and discussions on education, child development and well-being. And thank you, all of you, for showing so much love in all our previous episodes. One request from our side, if you can subscribe to our channel, please do it. If it is too much of an ask, that's fine. We'll still continue to do whatever we are doing. Thank you. Today we have a very special guest, someone who has dedicated her life on health and well-being through naturopathy, yoga and nutrition. Dr. Pushpa. She is a naturopath and yoga physician over 10 years of experience. She has been helping individuals and children to develop strong foundation on physical, mental and emotional health. Dr. Pushpa, welcome to our podcast.
Thank you. Thank you for inviting me here.
We are honored. Yeah. So, I first heard about naturopath only few years back. What is this naturopathy all about? I've heard about homeopathy, Ayurveda, and even allopathy. Allopathy is all over the place. Okay. What is this new concept of naturopathy?
Okay. First, I'll tell you what is naturopathy. Naturopathy is enhancing or emphasizing your natural healing process within you.
Okay.
Using natural remedies or anything natural treatments. Probably it can be hydrotherapy or massage therapy or yoga therapy, diet therapy, acupuncture, which all are non-invasive. It won't give you any side effects. Okay. So this is naturopathy. And as you said, people know about homeopathy, Ayurveda, Unani. These all are the alternative medicine system.
Okay.
Like I think you have heard about Ayush.
Yes.
Everyone knows about Ayush.
Yes.
Ayush means A means Ayurveda, Y means yoga and naturopathy, U is Unani, and S is Siddha and H is homeopathy. So these are the alternative medicines. Okay. So the main difference what you can see with naturopathy and allopathy is, in allopathy they give you symptomatic treatment. In naturopathy it is not like that. We don't treat symptoms specifically. We'll treat the root cause, from where it is coming. If you are getting headache, from where you are getting headache, why you are getting headache. We lost all these things. But in allopathy, if you go and if you ask a doctor, okay, you have headache, you take this medicine. It is the process like that for them. It is a symptomatic treatment and ours is root cause based treatment. That is the difference between allopathy and naturopathy.
Okay. So how did you get into naturopathy? Did anybody introduce you, or what made you to study about naturopathy and yoga science?
Okay. I didn't have any idea about naturopathy before joining it.
Exactly. That's why it's even more interesting.
Yeah. Even I didn't have any idea about naturopathy. Okay. One of my dad's friend, he's a homeopath doctor. Okay. His name is Dr. Guru Prasad. He's a homeopath doctor and he's a principal in homeopathy college. Okay. He introduced me to this system. He told me, you just go, give a visit, see there, and if you like it, you go and join. And the day when I went there and I saw the climate and I saw the treatments, I fell in love with naturopathy, and that is what I wanted to be. From my childhood, I had dream of becoming a doctor, but I didn't know which stream to take. And even I was afraid to go to an allopathic doctor because they used to give me injections and all. Yeah. So when I just went to naturopathy college, I just fell in love with the treatments and the environment over there. Yeah. And my teachers, everything influenced me a lot the day one. Okay. Then later, I started doing yoga. We had yoga in our college. Daily morning we have to get up at 5 o'clock, 5:30. We'll be having yoga sessions.
Okay.
So that made me more healthy, and it kept me more joyful and made me more happy.
Okay.
So then later, after third year, fourth year, we came to know the treatments and all, and we have own setup in our college itself for treating patients.
Okay.
So that helped me more, and I started falling in love with naturopathy day by day.
Okay. So how is this studying naturopathy and yoga science
Hmm.
in a college
Hmm.
different from 1 month, 3 month, or 1 year
Hmm.
course which is there all over the internet?
Okay. Huh. Naturopathy, like it is a 5 years course.
Okay.
Okay, and we have got a doctorate.
Okay.
So there, what we do is we read all the things, whatever the MBBS doctor will read or an MBBS student will read. We have the same subjects, same anatomy, same physiology, or same chemistry, or same MD. Okay, modern medicine, everything is same. Apart from that, we'll learn pharmacology also. Even MBBS students will learn pharmacology. Along with that, we'll see with naturopathy how can we treat. See, if you have headache, they'll give you one painkiller.
Mhm.
So I know for headache they'll give painkiller. Naturally, what is the painkiller present in our body? Or else with the treatment, how can I treat the patient without giving medicine with natural treatments?
Mhm.
So we'll read that. We'll read the difference, what to give in a natural way, which is not harming the patient or which is not harming your body. That is one beautiful thing about naturopathy.
Okay, okay. So you mentioned interesting thing about which is not harming the body,
Yeah.
but body is already harmed. Because that is the reason I have an headache.
Okay. Yeah. See, it is not like you are treating something. I told you, no, it is root cause.
Okay.
You are getting headache because of something. Probably your lifestyle is not good, or else your sleeping habit is not good, or else you are not getting hydrated, or else you are not getting proper nutrition. There are so many things. We can't just say because of this you are getting this thing. Have to take your complete case history. Then I should analyze and I should get the assessment completely done. Then only I'll get an idea what is it. What consultation takes minimum 1 hour for one person, because
Okay.
we'll each ask each and everything. What is your food habit? Are you a vegetarian or non-vegetarian? How is your sleep? How much screen time you give? This is the new protocol we have got now. What is your
Okay.
screen time? So what are your habits? How often you eat junk? How often you wake up in the middle of the night? And are you doing any physical activity? Everything matters. It's a whole body well-being, as you said, emotionally, mentally, physically, everything is included in this.
So you said if I come to you, I should have full awareness of what I am doing.
Hmm.
But if I already have a full awareness,
Hmm.
probably I'll not get into it.
I didn't get your questions.
So, for example, you said you'll take the full. If I come to you saying I have an headache,
Hmm.
and then you will be asking me a lot of questions,
Hmm.
which are most related about self-awareness,
Hmm.
like screen time.
Hmm.
Am I vegetarian, non-vegetarian?
Hmm.
What is my sleep pattern and everything? So if I'm already self-aware, probably I'll not get into that.
Obviously.
So
That
how
is true.
how is this? What is your role
Okay.
there?
Hmm.
Is it to bring self-awareness to me, or is
Yeah.
there a medicine
No,
you're
it
giving
is
me?
like self-awareness. What you said was right.
Okay.
It is like you should not. Each person's body is different.
Hmm.
Okay. Probably you don't like cold. Someone else will like cold. Someone else will be sweating with AC also. Some people need AC every time.
Hmm.
Each person is different. So while taking consultation or while talking to the patient, we won't judge the patient. Okay, he has got headache, I have to give him this treatment itself. Okay, he has got some body pain, I have to give. No, it depends on the person, whatever he says. If he needs more relaxation, probably maybe he has some stress, so I have to concentrate on mental health first, so I can give him more yoga or some relaxing meditations or some relaxing techniques.
Okay.
This will help him.
Okay.
So these are all the things will be included. It's not like, and you have to be aware of everything, as you said. You should know what you are eating, you should know what you are doing, and you should know why your body is paining.
Hmm.
If it's paining on your left hand side, you should think, you should be self-aware of yourself. See, if I do yoga today, I can feel the freeness in my body.
Hmm.
I'll know what is the ease. Like if I'm free, how my body will feel.
Mm.
The next day, if you get some right hand or right shoulder pain, you will know, okay, this is paining. I have some problem here. So what you have done before, probably you might have done some hard work, or else did you skip your exercise, or else did you miss your meal or something, or else you are lacking with some nutrients.
Okay.
So these all matter. So when you're self-aware about yourself, you'll know where is the mistake and where to correct that.
Correct.
So that is the main thing. Realizing oneself and what is the problem. Your body is the only thing you have to be taking care of, nothing else, right?
Yes.
That is the only thing. If you do that, you don't need any medicine or anything.
True,
Yeah.
true. So, what according to you is yoga?
Yoga. Okay. For me, being happy, that fulfillment after doing yoga, or else while that pain when you bend, you'll get that pain, no? You
Mhm.
should feel that happiness. You can enjoy that pain when you start doing yoga daily. If you do yoga only once, you can't feel anything.
Okay.
It should be a consistent process of doing yoga daily. If you do that, you can feel that happiness, inner happiness, and you can see if someone does yoga one day, they'll say, okay, I'm full energetic, I'm feeling good. That thing comes when you do it consistently, like for months or years.
Okay.
It is not just bending or stretching, it is completely included with physical health, mental health, emotional health. It includes pranayama, it includes asanas, pranayama, meditation, and relaxation techniques, everything.
Okay.
It's not just I'll bend, I'll just sweat, and I'll go.
Okay.
That is not yoga. You have to feel that happiness. You should be aware of yourself, and you should feel where my body muscle is stretching and how much free I'm feeling.
Okay.
That happiness you'll get when you do yoga. I can't explain it.
You have
when
to
you
only
do,
experience
you can
it.
feel it. Yeah.
Okay, so definitely yoga is a very vast topic.
Yeah.
We'll try and keep our conversations relating to children
Sure,
because
sure.
that is what we are all most interested
Yeah,
in as Dew Drops. Coming to the question, from what age should parents uh, or children should start doing yoga,
Okay.
or parents should guide their own children to start doing yoga?
Probably 2.5 years is good.
Okay.
That is the time when they start listening to the commands, or whatever you say, they'll listen. They'll do. If you say you sit, they'll sit at that time. Till 2 years, they'll be like, if you say sit, they'll run.
Yeah.
That is the problem. Till then, at that time, from 1 to 2 years, they'll have enough physical activity because they'll be exploring everywhere, they'll be touching things, and they'll keep on moving everywhere. So, no need. After that 2.5 years and all, when they start listening to your commands, or they when start obeying your words, then you can just start slowly with little mild exercises, some warm-ups and all.
Okay.
No need of giving harsh exercise. You do headstand, shirsasana and all. You can't make them to do all those things. It should be very light, like little movements, head rotation, neck rotation, all the joints, just to keep them little flexible at that time.
Okay.
And that makes them even more happy. They feel okay, something is going on, and they'll get awareness, self-awareness.
Okay.
And they'll accept themselves. Okay, my hand is like this. They'll get to know where all the organs are, and you can tell them, see, this is your hand, you'll get this stretch, and this is the muscle. That is the right age for them to teach them their whole body parts.
Okay.
So 2.5 years is very good.
Okay.
And if you continue it for till lifelong, that is very much good.
Nice. So you mentioned exercise. What do you mean by exercise? Is it something different from yoga, or what part of yoga you call it as an exercise? How is that related?
Okay. Yoga is different, exercise is different.
Okay.
Yoga is like you'll be in some one pace, okay? It will be your own pace. You will stretch, you will take your own time to bend, you will take your own time to get up, and you will relax. There will be a breathing pattern.
Okay.
When you do asana also, we'll concentrate on our breathing, we'll concentrate on our body. But in exercise, it is not like that. It's a vigorous movement. So you have to complete 25 and you will be counting like this 1, 2, 3, 4. This is the pace you will go. So that is very much different. You are stressing more your body over there. You are giving some tension. Okay. Your mind will be like, when you are doing exercise, okay, I have finished 10. I have to finish even more 10 counts. So you will be in that mode. But yoga is not like that. You will be relaxed, you will be calm, you will be concentrating on your breathing, and that will give you more relaxing effect compared to exercise. I prefer yoga
Okay.
than exercise.
No, for
Exercise is also good,
Yeah.
but yoga is much more better. Both the things are needed, but
Mm.
you should see at what time you have to do yoga and what time you have to do exercise. If you do yoga in the early morning, you will get enough energy and you will get yourself boosted throughout the day.
Okay.
Exercise preferably if you do in the evening, that will be good for children's, I'm saying.
Okay.
Okay. So yoga is good if you do in the early morning and first thing in the morning.
Nice. See, Dewdrops is into Montessori education, and
Mhm.
Montessori emphasizes on freedom and movements, even in the environment, even in the classroom setup. How do you relate yoga? Because you're telling yoga is also self-paced,
Yeah. Self-awareness,
self-awareness, and all.
self-realizing.
So
Yeah.
how do you relate both? And
Okay.
will it help
I
the
think-
child?
Mm.
Doing yoga in a Montessori environment, is it like double help?
Yeah, that is true. It is double help. Yoga is also good. We are doing the same thing, but they are not aware of one thing. See, when child is taking the book or reading, or else if he is moving, he is aware of his body, but he is not aware of his breathing. See, when I tell him just sit down, close your eyes and start breathing, then only they will know they are breathing. They know that process, right?
Correct.
Unless, like, when you're taking the bottle or when you're taking the book, you won't concentrate completely on your breathing or else your body. But in yoga, you're concentrating completely on yourself. Even it will help. Moving also, it will help.
Okay.
But it has to be done. Yoga has to be done to make them sure to know what it is going inside their body.
So, do you recommend any yoga asanas to children? Maybe we can group them into 0 to 6 years of age, 6 to 12 years, and 12 to 18 years, or however you want to group them and give suggest some asanas.
It's not like grouping and all. For 0 to 6 years or till 10 years, we can give regular asanas like Vrikshasana, Trikonasana, Janushirasana, bending and more concentrating poses or asanas.
Okay.
And for this high school students, whatever you say, from 12 to 15 years or 10 to 15 years, we have to concentrate more on relaxation, meditation. Asanas also we can give, they can do everything, but not advanced asanas and all. Just relaxing asanas and relaxing techniques, probably deep relaxation techniques or some meditation, Omkara meditation, or more of concentrating so that they can concentrate more on their exams or on their studies. And to improve their focus and concentration, few asanas, Vrikshasana.
How often they should do it?
They have to do it regularly. If they do it regularly, it will help. You
So
can't do it
regularly
from-
is twice a week?
No, you have to do it all the day. It is
Okay.
good. If you can't do it all the day, take 1 day break. Do it on 6 days. That
Okay.
will be good, no?
Okay.
Like it's like eating. When you eat, no, you'll nourish your body. When you do yoga, you'll nourish your mind. Both are important. Even
That's
your
a
body is
punchline you
important.
gave. Yeah.
Even your body is important, so your mind. No?
Nice. So you mentioned about 10 to 15 or 16 years of age, they can do slightly advanced yoga. Is there anything, any specific yoga they should do, especially adolescent children who are going through rapid changes in their body, hormonal changes, boys and girls? Is there any specific asanas they should do or they should not do?
Yeah, not do, it's not there.
Okay.
They can do anything, they'll be flexible. So we concentrate more on stimulating the pituitary gland, which is the king, for releasing all the hormones. Okay. So for that, you can go for Ushtrasana, Dhanurasana, Janushirasana, Virabhadrasana, Shashankasana. All these asanas will help.
Okay.
There are even more asanas. It will take time to explain all those things.
Got it.
But everything is needed.
Okay. So is there any asanas they should not do considering the hormonal changes and body growth and all that?
Not much when they are not too much into yoga. Like all of a sudden you can't give them advanced asanas. If they're doing it from their childhood, it's okay. They can, if they have practiced, they can go with advanced asanas like this Vrikshasana or Mayurasana. These and all are little difficult, so they can avoid it at this time.
Okay. Good. So what kind of yoga should anybody be practicing when you say practicing from childhood? Because all over the internet there are different types of yoga. What are those? Is yoga the same, or
Hmm.
there are different types? What should anybody practice, or
Hmm.
how should they start? And
Hmm.
is there any progression to yoga?
Okay. So, yoga basically, before I said that, it should be in a normal, soothing, and calming process.
Yeah.
It should not be rapid. Some will do yoga very rapidly, and you'll see people doing Surya Namaskara very rapidly, and they'll do for more number of times. Main thing is yoga, you have to concentrate on yourself, on your
Okay.
body,
Mhm.
and on your breathing, and you should be relaxed. These things should be considered.
Okay.
Then only you'll get full benefits out of yoga. If you do vigorously, it is called exercise. That is not needed.
Okay.
When you do yoga, after finishing the session, you should feel refreshed, and you should feel completely energized. It should not be like, Abba, I'm done with yoga, I should go home and I should sleep. It should not be like that.
It's not like 101 Surya Namaskara I
Yeah,
did.
yeah, it should not be like that. You should be relaxed, and you should keep calm, keep your mind very calm.
Oh.
And even when students do this kind of yoga, like relaxing, calming,
Mhm.
after that, their concentration power will also increase. They can focus completely on one subject or particular one thing, and they can memorize easily. If your mind is
Correct.
completely tensed, you can't concentrate. That is the thing, no?
Correct.
So instead of doing vigorous things, you can do yoga, and you can.
Does
Yeah.
yoga also help children with ADHD and autism?
Yeah, it will help to certain point. It's not like it is completely getting cured with yoga.
Okay.
You can help, like giving little exercises, making them to give more concentration on particular thing, probably keeping a book on their head and balancing,
Mhm.
or blowing a candle, or keeping the candle little bit far and telling them to blow, so that they'll concentrate on one particular thing. These things will help.
Mhm.
And even other therapies has to be included to cure or to treat ADHD or autism.
Okay.
It is
Okay.
not like only one day you'll cure or 1 month you'll cure these things. It will take months to years to treat all these things.
Okay. Nowadays, we see a lot of children having a lot of screen time or addicted to games and all that. Somewhere their emotional well-being is also taking a hit due to gadgets. How does yoga help them? What should parents do to help those children?
Okay. So when you say child not to watch TV, even the parent should be doing that.
Correct.
You are sitting and you are scrolling, and you are telling the child not to watch TV or not to scroll. That is a wrong thing. When you are teaching your child something, even you have to do it along with them.
Correct.
And you should set some clear boundaries. See, this is the time you have to use the mobile. After 30 minutes, you are not supposed to touch the mobile. That clear boundary should be there between the parent and the child.
Mhm.
Then only it will help. Another thing is, it's not like with yoga, you can't help the child to make, they'll do yoga and you go home, and the parent will say, okay, I'm a little busy, I'm tired, you don't bother me, you take mobile and you watch it.
Mhm.
That is not going to help. Parents have to keep clear boundaries, telling them you should not watch the TV at this time, or else only your time limit is this much.
Okay. Okay. Is there any yoga poses where parent and children can do it together, so that
Okay. Any yoga poses, they can
asanas?
do together everything. They can do
Okay.
everything. If parents does it, even child will do it. Even parents have to learn. See, it's not like only child has to do yoga.
Mm.
Yoga is for everyone.
Okay.
Everyone can do it. And when the child sees you doing, next day even child will come with the mat. Mama, even I'll do it. Or Papa, even I'll come and do it with you. So that is the thing. You have to inculcate, and there are so many. You start doing it, and you need a guide. You can't just start all of a sudden. You need a guide, you need a teacher for that. First, you have to learn, then you can do it in home.
Correct.
Different people will have different perspective of yoga, right? Some people will be like, their intention, I have to lose weight, or else my child is obese, I have to make him lean, so I'm making him do yoga. That is not right. And you
Okay.
need a guidance. What kind of asanas the child should do if he has some problem? What kind of asanas the child should do if he has low concentration or focus? That and all, you have to meet some doctor and take guidance, then you can do in home. Or else for natural well-being, if you have learned yoga, well and good, you know how to do, you can do it with child, you can do any asana.
Okay. Okay. So now we'll shift our focus a bit to nutrition.
Hmm.
Um, Is there any link between well-being,
Hmm.
nutrition, diet,
Hmm.
yoga?
Hmm.
How would you relate all these?
Okay, everything is interrelated. Okay, see, we say gut and brain connection.
Hmm.
When your gut is healthy, your brain is also healthy. It will do its work properly. So what you eat is more important to maintain your good microbiome in your gut.
Okay.
So if you are eating healthy, your gut is happy and your brain is also happy, it will do its work properly. When you eat junk, when you eat unhealthy food, even your gut is not happy, even you won't be happy. I think you have seen children when they eat more processed food or sugary items, they'll be very hyperactive for a few minutes. Then they'll go down. That is how it works.
Okay.
When the sugar spikes, they'll become more active. And after some time, they'll feel more tired. They'll be like, no, mama, I don't want to go out. I don't want to play. This and all comes with these things. But when you eat a healthy food, probably some whole grains, nuts, seeds, or dry fruits, or you can have some vegetables, fruits. Give this and see the changes. Give this for 2 to 3 days for your child
Okay.
and see the change in your child, how he behaves and how calm he will be. Everything is interrelated.
Okay. Okay. So when we say junk food is all over the place. Because you get an example of chips.
Hmm.
Chips is literally
Hmm.
there in every tiny shop you
Hmm.
see, right?
Hmm.
And it is visible to children also.
Hmm.
So inevitably they eat
Hmm.
chips
Hmm.
whenever they go to a birthday party. Even if I am avoiding, whenever they go to a birthday party, some place, they end up getting that taste and they want to have it.
Hmm.
How do we avoid it as a parent? What tips do you
Okay.
have as a
One thing
parent?
is, if they are more attracted towards that, you start doing it in home.
Okay.
Okay, you can prepare in home, you can keep it in home, and you can give them. Another thing is, you keep them some boundaries. Okay, you eat this only at this time, and even when they go out and they when go out for birthday parties and children will bring chocolates to the school for birthdays and all
Correct.
these and all, you have to tell them, if you have got chocolate, you keep it for Sunday, or else if you want, you have it little.
Okay.
We all are so rich, we can give chocolates to whole school instead of giving to the class.
Correct.
And you are not giving in a small piece, small chocolate, you are not giving small chocolates, you are giving big bars so that everyone will enjoy.
Correct.
That is spoiling everyone.
Correct.
You leave long term diseases, probably diabetes, obesity, everyone knows about this. India has become capital of it. But short term, you see irritability, you see they're becoming more cranky and they have more mood swings and they won't listen to your this thing. They'll be more hyperactive, they'll jump from here, there, and they can't concentrate. These are all short term effects of this junk food or sugary items.
Okay.
So limit it. When you send with your child, make sure if you want to give, you can, there are so many alternatives. You can give some fruits, you can give dry fruits or some homemade chocolates or low sugar chocolates you can give. This and all will help. Or else if you want to send, make sure you are giving some small chocolate, not a big bar.
Correct.
It is spoiling everyone's health, right?
Correct.
Whole school is getting the
Correct.
same thing.
You mentioned chocolates and junk food. Probably we can set a time and all that. Similarly, schools have a rule on that. Only Friday they can bring junk, or only Wednesdays they can bring it, something like that.
Okay.
Right? It's so funny
Huh.
because the practice
Yeah.
starts happening from there,
Exactly.
and probably children are waiting for that day to
Yeah.
carry the.
See, when you know junk food is bad, why are you encouraging it on one day?
Yeah.
One day will also become an habit, right?
Correct.
Junk is junk. It won't become a good thing, or junk won't become a fruit or vegetable which helps your body if you eat weekly once, right?
Correct.
Junk is junk. So you keep it away. I think it's not a good idea to encourage junk in schools.
Okay.
At least in schools with friends, they can eat some healthy food. They can send some fruits, vegetables, some dry fruit ladus, or some energy bars which are homemade.
Okay.
That will help them more.
Okay. So, what advice do you have parents to pack a nutritious meal, especially for lunch? Even you can suggest for breakfast. What advice do you have for parents?
Okay, anything would be good which is homemade and which is a balanced diet. See, balanced diet is which contains all the vitamins, nutrients, everything should be there. Some people will do upma. Upma doesn't consist any vegetables. That is bad. If you are doing upma, put some vegetables into it. Let it be nutritious. Let it have some fibers, some minerals and vitamins. If everything is included, that is well and good. Each, like some regional food are different.
Okay.
See, like in Bangalore, our staple food is like rice. We prefer chitrana, or that is chitrana, or
Yeah,
chapati,
anything
idli,
to do with
dosa,
that,
something like that. So I can't just specifically tell you give only dosa this day.
Yeah.
It's up to you, but see to that that is nutritious. You
Mm.
are doing idli, like for small children, they won't eat beetroot. So
Mm.
you blenderize the beetroot, add it to idli and give it. They'll have, it won't give the beetroot taste. So everything, if they are not willing to eat that, you mix it with some other food or make it within different form. If they are not liking to eat directly, make it in a form of juice or give it in a form of salad, or else mix it with some other. You can put it in sambar. If they don't like capsicum, you make something out of it, roast it and give it. These are different ideas which they can include. And
Yeah.
moreover, children should be included while cooking.
Mm.
That is the main thing. So when they see, or else you have to take them for grocery shopping and tell them to choose some fruits or vegetables which they like. This will improve their interest in food.
Correct.
You go and you make something and they don't like the taste. So when they go, then you can tell them, okay, we'll take carrot today. Carrot is very good for your eyes or something. You just keep telling them this is good for this, or this vegetable is good, you can have at this time. That and all will help more, instead of just bluntly going and giving them, no, you eat this.
Yeah.
That won't happen. And make it, children's are more attractive to different kinds of things. You can't give only one thing. You can't give only dosa every day. You have to make varieties of dosa.
Correct.
One day spinach dosa, one day you can give beetroot dosa, one day you can give onion dosa. There are so many varieties. You can just look online, you will get more recipes. So
True,
your
true.
children will get more interested.
It's very interesting that you said involve your children even while grocery shopping,
Yeah.
even while cooking.
Hmm.
But what we see is the
Hmm.
entire opposite. They are not involved even while eating. They are on mobile.
Yeah, that is also
Yeah.
that is also an important thing. And make your environment more enjoyable while eating.
Mm.
Even adults should not use mobile. It will be like father will be like, no, I have an important call. I will, no, even you, when you are setting boundaries for a child, even you should follow the boundaries, and you should have some boundaries.
Correct.
Even you should keep your mobile aside, sit with the child, have mindful eating. What they eat, it should be enjoyable. They should feel the texture, they should feel the aroma, they should feel the taste of it. Everything is included. When it happens only when you do mindful eating. When you see mobile, you keep on eating, you don't know what you are eating.
Correct.
When you're watching movie, you keep on eating popcorn or anything, any junk food. You won't stop. Why is it? Because your brain won't send the information. That satiety center is there, which will say, okay, this is enough for your stomach is full.
Mm.
When you keep on watching something, your concentration will be there.
Correct.
Your brain won't signal you to stop. So you keep on eating. Chips will go. If you eat potato chips though, it will go 4 packets, 5 packets and all they'll eat, which is not good.
Correct.
So whenever you are eating, your mind should be only on your food and only on your plate and how it tastes. Enjoy each and everything.
Yes.
Then your food, and it will improve your digestive power also.
Okay.
Then you won't get problems. Like most of the time you can see parents saying, my child has some discomfort, he has diarrhea, he has stomach pain, this and all. These things will all come with these. Like they don't know what they are eating.
Correct. Okay. So I would like to take up some of the parents' questions which
Mhm.
they have sent it to me. So one of the parent has asked, from what age should parents really worry about child nutrition?
From the day one.
Okay.
Probably. After 6 months, they'll start weaning food for the baby, right? From that day, nutrition is very much important, because
Okay.
nutrition is the fuel for your body.
Mhm.
Okay, if you put the fuel properly, if the fuel is good, your body will run properly. If the fuel is not good, if it is mixed with kerosene or some water, like how you mix the junk, it is same thing.
Correct.
If you do that, even your body, your health will get upset.
Okay. Okay. And the second question is, if my child is going for an early morning sports like football, what should I give him early morning or soon after he comes from the sports? Because as soon as he comes back from the sports, he has to go to school. So what should be the nutrition process there?
Okay. See, when he comes, you should see when to give breakfast, what is pre-workout food and what is post-workout food.
Okay.
And you have to concentrate on that. If he is going in early morning means, if you give after food, then you are skipping your breakfast. So you have to include both post-workout food and your breakfast. It should be high in calories. Probably you can give him, if they are non-vegetarians, you can give some egg or else some peanut butter toast. Along with that, you have to give some regular breakfast also.
Okay.
Like some fruit smoothies you can give, or else you can give avocados, or else you can give some sprouts.
Okay.
These are all will help.
Another parent has asked another question: can they give milk? Because that's been the hot topic in the recent days. One is they can they give milk, and also drinks like bournvita, horlicks, and boost.
Okay. First we'll come to milk. Milk is a controversial thing.
Okay.
So milk is not needed that much after 2 years. See, why we give milk is we give milk to the infants because they can't chew, they don't have teeth. So we give milk to that children. So it is easy to digest and they can consume it easily. We are adults, we have teeth, we can have enough nutritious food, enough nutritious fruits, vegetables, and you can eat dry fruits, everything we can eat. We can compensate it with this. If you want, you can give milk, but not on regular basis. Don't add sugar to it. And what you say, this bournvita and all other things, they contain high content of sugar. That is not at all good for your child. Instead of that, you can make some dry fruit mix, dry fruit powder, add it to the milk and give. Instead of milk, you have so many alternatives. You have ragi milk or coconut milk, oats milk, soya milk, almond milk. So many options are there. And even children won't be bored if you keep on changing the milk instead of giving only cow milk regularly on the regular basis. This will help.
So should children eat when they are hungry or based on time?
Children should eat based on their time.
Okay.
You can eat when you are hungry, when you become old.
Okay.
Okay. So it is the phase where their rapid growth is happening. So you have to give them food properly, and nutritious food is very much important. And you can see children eating only rice and dal. Rice and dal has nothing. A little bit of protein is there, but it is not enough for your body. Along with rice and dal, give them some fruits and vegetables. Give them palya. Send them some fruits. They can have fruits before food. Then after they get appetite, then they can have their lunch. Fruits, vegetables should be included in the daily routine, daily meal.
Okay. After talking to you, what I feel, we should have a nutrition awareness program every year in our school for both children and parents.
Sure. That is very much needed. See, everything is included, right? What you eat, whatever you are is what you eat.
Correct.
Sorry, what you eat is what you are. Okay, so whatever you eat is very much important. Even one banana, if you eat, what it is happening, you should have an idea. Okay, probably sometimes you can see constipation cases in children very much. One thing is they don't have enough fiber in the food. They won't eat any vegetables. They don't eat any. If they don't eat, you have to make some effort to make them eat. Give it in different forms or make them some interesting
as a parent,
recipes.
You have to be creative.
Yeah, you have to be little creative, or else include them in cooking. You ask them how you want it to be. When you include them, they'll give their ideas. Okay, mama, you make roast of this today. I'll eat it.
Sorry.
You should not say, okay, he doesn't eat capsicum, so I'm not giving him capsicum. I'm not getting capsicum to home itself. They'll ban capsicum from home. You should not do that. When they're not eating, include them, make some ideas, then they'll eat.
True. So, coming back to Dew Drops, you have been associated with Dew Drops for over almost 10 years now. What made you to join Dew Drops? How did you come to Dew Drops?
Dew Drops, one of my mom, I was working with her. Her name is Dr. Manjula. She introduced me to this. She's a homeopath doctor. She introduced me to this school. I started, even I didn't have any idea about Montessori at that time. Then the day I came, I was surprised seeing all the materials and all, because I am from a normal traditional school. We didn't have that opportunity to have all those things. And the materials and different kinds of things, each and every part is there. Like for leaves, different colors of leaves, different shapes of leaves. I was like, I should study something. I don't know anything after coming there. I was very much interested, and I saw the teachers and them including themselves with the children and teaching them, sitting with them individually and teaching them.
Correct.
This all made me fall in love with this school.
Nice.
Since then I'm here.
Okay.
And I love the way how they teach. And children also, they are free to do anything over there. They can go, they can explore anything. If they want something, they'll go themselves, they'll search the book, they'll read. It's not only about the subject or about the particular topic. If they're interested, one day I just came here, and it was a lunar eclipse day. That day children were like, they were sitting and they're talking with the teacher. Okay, what happens in lunar eclipse? Sir was like, Ravi sir was like, you go search, see in the book. They read, they came and they explained wonderfully. I was mesmerized. What is this? How can children do all these things?
Correct.
They have that ability, but we were not leaving them to do that.
Correct.
I saw this freedom in this school, and that made me to stay here till now.
Nice. You have been working with our children for almost 10 years now.
Yeah.
And also you have interacted with many other patients who come to you and all that. What is that one thing you wish parents understood about their own children's health?
Okay. First main thing is mobile.
Okay.
They have to avoid screen times and junk food. These are the two main culprits which are spoiling the children now.
Okay.
And lack of physical activity. Because of mobile, they are having lack of physical activity. They are not going out. They are stick to mobile. They'll be doing all. You have to take care of all these three things.
Okay.
When you take care of these three things, everything will come to you.
Okay.
Like even their health is important. See to that their weight is properly in the normal range, or they are growing in proper height.
Okay.
Everything matters. How if they are falling sick often, you have to rethink what you are feeding your child and where it is going wrong. Everything is included. Give them some nutritious food and balanced food. Give them some physical activity. And another thing what I see is they are sending them to some classes, 2 to 3 classes together. They'll go to dance class, again they'll go to singing class, they'll go to karate class. These many hobby classes are not required. They need some unstructured play time.
Okay.
In that time they'll become more creative. So stop making them to go to so many classes. After school even they'll be fed up. Even if you are sent to that many classes, even you will feel tired. No.
Correct.
That is hobby. That will come. It has time. They can do it after they become 18 years old or probably 30 years. Hobby doesn't end at any age.
Correct.
If they are interested in something, let them do. One work is enough. Don't put more stress or more pressure on child. You go to dance class, you go to singing class, you go to yoga class. Don't stress anything. Make one thing which is more comfortable for them and try to encourage them in that itself. Give them some unstructured play time, which improves their concentration also, which improves their creativity, which is more important.
Correct.
Let them be bored, let them sit for half an hour, nothing will happen. As soon as they say I'm bored, you'll give mobile. As soon as they say they are hungry, you'll give some junk food, so that they won't feel hunger for short duration. After eating the junk, they won't eat the food. They'll be like, no mama, I'm full. Don't do that. If they are hungry, give them some healthy food. Give some peanut butter and almond, give some strawberries, give some papaya. This is also an easy thing to give, no?
Correct.
Banana is easy. You can just take like this and give, instead of giving a packed chips and or your gobi or some noodles, anything.
True. Okay. So how, if any parents has to reach out to you for consultation, how can they reach out to you?
Yeah, I have my own clinic.
Okay.
It's Trana Nature Cure.
Okay.
It's in Kurubrelli.
Okay.
I'll just give you the address. If you want to contact me, you can contact me anytime.
So with your permission, can we put it in your description?
Yeah, sure, sir. Sure, you can.
Sure. Thank you.
Yeah.
And we are at almost the final part of our podcast. And these are the questions which we ask all our guests. One book recommendation if you have for our parents as well as children, what would that be?
Okay. From my side, my favorite book is The Secret Magic book from Rondé.
Okay.
You can just go with it. It will give you more positive energy. It will make you to think more positive about yourself and the environment and how you get connected with the universe. Everything is included in the book.
Okay.
So it does magic. Please go and read that book.
Sure. And we need you to recommend 3 people whom we can invite for our podcast and who can share their experience with our parents and our audience. Who would that be?
Okay, 3 would be difficult for me. I can say one.
Okay.
Probably Ravi sir is a good option.
Okay.
You have to bring him here. I've seen him, his way of thinking and his way of conveying the message to the children or parent is very much different, and I have learned so many things from him.
Okay.
So I like if he comes on this podcast.
Sure.
It will be more
So we'll
useful.
definitely invite Ravi sir. When he comes, what is that one thing you want to ask him so that we'll ask on behalf of you?
Okay. I want you to ask him why parents should not be worried about the child's academic progress.
Okay.
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 Yeah, as I know, each child is different
Mm.
and they have their own level of reading or probably grasping and all. He explains it very much better. You
Okay.
don't be worried. They'll have their time, they'll go, they'll read. You don't be worried. He'll give that very good explanation about that and it will be very useful for parents.
Definitely we'll get him on our podcast.
Yeah.
We'll definitely ask this question.
Yeah.
By this, I think we are good. Thank you so much
Yeah.
for coming. It's our honor,
Yeah.
and hopefully your message reaches a lot of parents.
Yeah.
Thank you so
Thank
much.
you so
Thank
much.